Hey team, it's Dr. George here from Melbourne, and a big hello to my friends where you are in the world, whether you be in Australia or whether you're a fellow lockdown-erino here in Melbourne. I just wanted to share some news by the Australian Deputy Chief Health Officer, Dr. Nick Coatsworth. Now, he is a respiratory physician as well as an infectious diseases expert. Now, we can take his word with a lot of weight, because with him and the advice of the Australian infectious diseases team, they've been reviewing the data, the information that was sent to the WHO recently that was talking about aerosols in the use and how they transmit the coronavirus. Now, this team met and discussed the findings, and they had the following to say: that primarily the way that the coronavirus is spread is through droplets. So that's large particles of respiratory secretions that are spread through coughs and through sneezes. And these can either be inhaled, land onto your hands, and then you touch surfaces, or you could touch the surfaces where these droplets have landed. So the key message is that hand washing is vital in breaking the cycle of the coronavirus. Social distancing is vital in breaking the spread of the coronavirus. And if you are unwell, get home and get tested. Please, I urge you. Now, within certain situations, the question of whether aerosol spread needs to be considered, and the use of masks. And what we know is that in situations where there is an increasing amount of community spread of the virus, in particular Melbourne and Victoria, there is value in wearing face masks when you leave the home, remembering that the 4 reasons to leave the house if you are currently in lockdown in Melbourne are: to attend work if you cannot do this from home, to seek medical care, to buy food, or for exercise either by yourself or with only one other person. The recommendation is that masks are worth considering in these situations if there is a chance that you may not be able to socially distance. And I would put it to you that if you are going to shops, if you are going into that space where there can be a lot of people and less ventilation, it is absolutely worth considering wearing a mask. Now, it's important to be aware that they're recommending things like surgical masks and the cloth masks. These sort of masks, this is a P2 mask. They're very expensive. They're about $20 each. This is an N95 mask, which is very similar to the P2. They're expensive, and they are actually quite tricky to fit. So these are recommended for people who've been trained with health professionals. However, surgical masks and the cloth masks are the ones that they're recommending. And I just want to remind you of a couple of important tips. There's a colored side and there's a white side. The colored side faces out, the flaps point down with the flaps, just like on a plane. Now, the top of the mask generally has a little bit of metal that you can use to shape against the neck. The trick is, don't touch the front of the mask. With the earpieces, you just pop it onto your nose, bend it over the nose, then get the earpieces over the ear. Then grab the very corners of the bottom and pull it down over the chin. La voila, you are now wearing a mask. You might be surprised to know that you can still hear me even though I'm wearing a mask. So there is no need to pull down your mask when you're trying to speak to people. We don't need to lip read. We can still hear you perfectly well. Now, never touch the front of the mask, because if there's going to be coronavirus, that's where it's going to be sitting. And if you touch it, you'll get it on your hands and the spread starts that way. When it comes to removing the mask, don't touch the front. Just grab the little earpieces and pull it off your face. I recommend you put it into a plastic bag for disposal. I'm not a big fan of the huge amount of medical waste that we are currently making. So if you've got a cloth bag, what you can do is put it into a plastic bag, and every time that your cloth mask gets wet, you can get a new mask out, put the wet one into either a plastic bag or a cloth bag, and then at the end of the day, you give them all a good wash and pop them in the dryer. And that way they'll be fresh, clean, and sanitized for you to be able to use in the next few days. But please look after yourselves, look after each other. In your Melbourne teams, don't be afraid to reach out for help. Doctors like me are available for phone calls, and we can do telehealth, and in emergency situations, we can also organise face-to-face care if it's required. But first, we'll have a chat with you on the phone. Look after yourself, look after each other. We can get through this.